My name is Schutte. I'm Professor of Cardiovascular Medicine at the University of New South Wales in Sydney in Australia and the George Institute for Global Health. And today I will be speaking about the importance of screening for blood pressure and for atrial fibrillation at home. So first of all, it's important to screen for high blood pressure and AF more frequently in the community because there's absolutely not enough time in GP practices to do that. And so we recommend for everyone older than 18 to have their blood pressure screened. But for atrial fibrillation, because it's a consequence of high blood pressure, it only develops from age 65 and onwards. So screening is usually recommended at that age. But busy GP practices, it's hard, it's not often done to have ECGs done on a regular basis in every patient. Even blood pressure is not measured frequently enough. So the recommendation is actually to optimize home blood pressure and AF screening because we have devices that can do both now and one go. So that can be a way to overcome the challenges in primary care to do all these measurements and have patients who already have a blood pressure device at home with the AF screen functionality to do a simple screening there, which provide reliable measures for clinical decision making. We have many blood pressure devices available now, but home blood pressure devices especially, only 1 in 5 are actually validated for accuracy. So it's really important to ensure firstly that patients use validated devices, which can be assessed through the website Stride BP. Easy to assess it there, but you can't rely on a blood pressure that's not taken with a validated device. So we strongly recommend that GPs are aware of this and also recommend to their patients to get validated devices. Home monitoring data is now becoming the gold standard for measuring blood pressure because we know in primary care that time to do that is just a limitation. So home blood pressure and ambulatory blood pressure are the gold standards now in all international guidelines. The thing is, there's many GPs that are still reluctant to rely on home blood pressure devices and the monitoring by patients themselves because they can make errors. So firstly, they should ensure that the patients get training. It's always recommended to have someone either practice to train patients on how to do it, get the validated device, where to find it, and then to train them how to do a measurement accurately. There's many things that can go wrong. But if a patient is trained, they will provide reliable blood pressure data that can be used for reliable clinical decision making. It has to be a process.